I'm Carmen Payne, and this is my stroke assessment video. Hi there, my name's Carmen, one of the nurses here. And so what made you come to the clinic today?
Well, since this morning I've had severe headaches and numbness on one side of my face.
Okay. And so when did the headaches start?
Early this morning.
Okay, did the numbness start about the same time?
About the same time.
Okay, so does the headache go anywhere else on your body? Or does it radiate anywhere
It
else?
radiates down my face and I get tinglings in my fingers.
Okay, alright, so if you can give me a number, 0, no pain, and 10, the worst pain you ever had, what number would you rate the pain?
I would rate the pain 9.
Okay, and so it started this morning, so you've had it for a good few hours. So did you take any pain medicine at all?
I took Tylenol 3s.
Did that help?
Not very much, no.
Okay, have you ever experienced anything like this before?
I've usually had headaches, but not this severe.
Okay, so just looking at your vital signs, your blood pressure is 180 over 85, so it is a little high, and your pulse is 80, which is regular. I'm just looking, you have no fever, it's 36.5 oral, so that's good. So what I'm going to do, I'm going to assess your cardiac system first. So any chest pain or tightness?
No.
No, or any dizziness at all?
No.
No? Okay. So have you had any, like, it looks like you've had history of high blood pressure, just reading your chart? Yeah?
Yes.
Okay, so any history of any cardiac surgeries?
No.
Nothing like that. Okay, or any strokes previously?
Not previously, no.
No? Okay, so what I'll do is I'm just going to listen to your carotid artery. So I'm just going to walk over here. So if you want to just remain seated. So I'm just going to use the bell of my stethoscope. So I'm just going to take a listen here for any breeze, and that's the swishing sound. And I don't hear anything. So everything's sounding good. Okay, so the next thing I'm going to have you do is just have you lie down, or lie down 45 degrees. That's perfect. Okay, so if you can turn your head to your left-hand side. Here, we'll just put this pillow here. So what I'm going to do is actually I'm just going to measure and check your jugular pulse here. And so it's just for any pulsation, and I don't see anything, like it's about, if I measure, it's about 2 centimeters, which is normal. And so everything's looking good there. Okay. So the next thing is I'm going to listen to your heart. Okay, so I'm just going to inspect and take a listen. Alright, so I'm just going to take a listen to the aortic area. Well, actually right here is the aortic. It's in the second intercostal space. And over here is the pulmonic area. And that's the second intercostal space to the left. And if we go down here to the Erb's point, so basically the Erb's point is the heart sounds are equal, and going back up to the aortic area, there's the heart sounds are S1 and S2. So S1 is the first heart sound and S2 is the second. So basically the second sound is louder, and when I go back to the pulmonic area, the S1 sound is the first one, and S2, the second, sounds louder. And then the Erb's point, going back to that one, both heart sounds sound the same. They're equal. And then when I go over here to the tricuspid area, it's in the lower, sternal area, the lower left sternal area. Basically, the first heart sound and the second heart sound, this one, the first heart sound is louder. And then the mitral area, basically, again, the first heart sounds louder. So what I'll do is I'm just going to listen to your heart. And if you just want to exhale for a bit. Okay, so it's sounding regular. What I'm doing is just going to find your carotid pulse and compare the two just to see if they're equal. Now, have you noticed any palpitations, like your heart's a little bit irregular at all? It sounds regular right now.
No.
Okay. Alright, so that's sounding good. So the next thing what I'm going to do is I'm going to just check your brachial pulses and just see if they're regular. And yeah, everything's feeling good. So now I'm going to go down to your radial pulses and just assess and make sure everything's equal. It feels regular as well. And then under your knees, there's also some pulses that I can check, just to make sure everything's good. Perfect. And now right behind your ankle, the tibial area here, I'm going to check your pulses. And everything again feels regular. Now the dorsalis pedis, checking your pulses, and again both feel regular. Okay. So the next thing what I'll do is I want to assess your neurostatus since you're having some numbness to that right side. Okay. So what I'll do is I'm just going to check your pupils. Now, have you had any type of seizures or tremors in the past, or
No.
no, and
No.
any numbness or tingling or or any weakness that goes anywhere else in your body
No.
besides that right side of the face?
Just that right side.
And you had some tingling earlier, and that's gone
Yes.
right now.
Mhm.
Okay. Any balance problems? Because I
No.
saw you walk in and you seem
Yes.
to be pretty steady on your feet.
Yes.
Okay.
No, no problem.
Okay. And talking with you, you seem alert and oriented times 3, person, place,
Mhm.
and time, which is which is good. Okay. So
Mhm.
what I'll do here, I'm gonna just get my pen light and I'm gonna check your pupils. Okay. So what I want to know is if your pupils are reactive and they're responding to light, they're constricting and equal in size. Okay. So I'm just gonna grab my pen light and check your eyes. Okay. And so everything, so I'm seeing that your pupils are constricting except for the right one. The left one's a 4 millimeters, so that's a normal size, but this one's more dilated and it's not constricting. So what I want to do is accommodate tests. So basically that's checking your cranial nerve 6. So if you can stare at an object somewhere in the room, okay. So now I'm just going to follow my pen light. It's going to go towards your nose. Okay, and I see that your eyes are crossing towards the nose, so that's good, except for a little bit to the right. It's not, it's a little bit more fixed there. Okay, alright, now can you follow my pen? So I'm just checking some other cranial nerves just to see if your both eyes are following it. Great, okay. Alright, so the next thing what I want to do is if you can open your mouth and go ah. So I'm just going to check if you see your tongue. It does go more towards your right. Okay, so you can close your mouth now. Okay, so what the next step, what we're going to do is I'm going to do a few more tests, okay? And so the next thing I'm going to grab is a cotton ball. So I'm just going to check and see. You want you to close your eyes and just tell me if you can feel the sensation. So it's a light touch test. So tell me if you can feel.
I can, yes.
Yeah, and when I touched your feet, like right over here, you could feel it without your
Yes.
socks on earlier, right? So you can feel this?
Yes.
Okay, so I would go up both legs. Okay. Can you still feel that?
Yes.
Perfect. Okay. And actually, while I'm here, since you are having that right numbness, I do want to check to see assess your cranial nerve 7. So if you can smile for me. Okay, so we want to look for to see if they're symmetrical, and this one is going down a little bit. Now, can you raise your eyebrows up and frown? Okay, so we want them to be symmetrical, and again, the right side is going down a little bit, so we'll make note of that. Now, the next thing what I'm going to do is a pain test. Okay, so there's a sharp and dull end. Here's a Q-tip. So just tell me if you can feel if it's sharp or dull. Is it sharp? And this is the dull. Can you feel that?
Yes.
Yeah, so which is this? Is it dull or sharp?
Sharp.
Yeah, okay. And how about this side? So I'm going to check both sides. And we would check all the way up.
Okay.
And you can feel which is it dull or?
Dull, sharp.
Is that sharp? Okay, perfect. Alright, so now the next thing what I want to do is check your motor strength, okay? So I'm gonna grab your hand. Now if you want to squeeze really tight, so squeeze my hands really tight, so I'm just checking your strength. Okay, great. Is that tight as you can go? Okay. So they do feel equal in strength. Now the next thing what I want you to do is push down my hands. So push down, go down. There you go. Great. Now pull up. Okay, perfect. Yeah, no, the strength's equal. Okay, that's great. Okay, so now the next thing what I want to do is I'm going to just check your tendon reflex. Okay, so it's called a Achilles reflex. So what I'll do is I'm just going to cross your foot over here. Okay, so this is my reflex hammer. So we're going to just check, and I want to feel that your foot kind of flexes into my
10
hand,
seconds.
which it did. Alright, now the next one, I'm just going to do the same with my reflex hammer. Just checking your reflex.